Vision problems in children are rarely described as blur. I think that's partly due to the fact that children have difficulty articulating blurry vision. It's also due to the fact that sometimes it's not blur that's causing a vision difficulty in a child. Sometimes it's double vision. Sometimes it's simple eye strain or getting tired when you're reading. If the child has any trouble focusing, they're not meeting reading milestones, if they're getting unexplained headaches or showing disinterest in near activities, it's time to have their eyes examined. In addition to a preemptive annual eye exam, your child's pediatrician and their teacher at school are your best friends in early diagnosis. When it comes to things that children can have difficulty focusing on for their vision and for their binocular vision, I think it can be determined in a way of asking certain questions. You need to ask your child how their eyes feel in a way that, do they make you feel tired? Do they make you want to take a nap after school? Does it make it feel better if they're rubbing their eyes? Demonstrating to a child what double vision looks like. A lot of times they just haven't encountered that word before, so being able to see double, I think, can be hard. Is your child using their finger to follow along with a near task for longer than is age appropriate or their peers are doing? Are they losing their place when they're reading? Another great thing to ask your child is what a story was about. Sometimes your eyes have to work so hard to keep an image clear and focused that they're not necessarily working on comprehension. So if your child's able to get through a story, but they're not able to tell you what that story is about, it's a sign they're maybe focusing a little bit too hard, and that glasses or vision therapy could be of assistance to them. The same is true in being farsighted. Children have a very strong focusing system. An analogy I like to use for that is standing on your tiptoes. If you're standing on your tiptoes next to somebody who's taller than you, you look the same height in a photo, but you're working harder at that. That's like being farsighted. A child can see what their peers can see, but they have to work harder at that. So how we suss out that visual strain, I think, is really important, and certainly that can be done at a dilated eye exam with Art of Optics.